So Sabu is our Asian elephant bull. He's about 37 years old, and he's had his entire life, he's had some varus rotation on his front legs, which means that his toes are kind of pointed in almost like a bulldog would be. And over time, that led to him developing pretty significant arthritis in his elbows of both of his front legs. And so there are lots of different options for things you can do to try to treat that. There are joint injections or anti-inflammatory medications you can take orally. There's not a lot of, there's some things you can do in smaller animals that you can't really do in an elephant. And then there are a lot of things that can be done in humans or small animals that you can do in an elephant. And so eventually we decided, in consultation with a pain medicine specialist for companion animals, that Arthromed injections into his elbow joints. That injection is a hydrogel, and once it's injected, it incorporates into the lining of the joint, and it causes that joint to be more resilient, and it decreases inflammation in that synovial membrane, that lining inside the joint. By doing that, it makes him less painful, it makes him able to move his joints better. It overall should provide some relief for him, and it can last about 18 months as shown in horse studies, and up to 5 years as shown in people studies. So it's a long-lasting injection that incorporates into his membranes and makes everything more comfortable for him. And after probably 10 weeks or so, we started to see some improvement in his overall mobility. We have comparable data before and after the procedure. And then by 3 months-ish, he did something that he hadn't done in almost 3 years. He laid down overnight, and he's been laying down to sleep every night since then. So we see that as proof that he is more comfortable and he's able to lie down and stand up more easily and is more confident in his movements. We've also seen increase in movement around his habitat and kind of better behavior around our female elephants.